Veterans and their families know the price of freedom, a price that can be seen inside VA medical facilities. VA is honored to serve the men and women who bravely wore our nation's uniform. Our care teams take great pride in providing quality care to more than 9 million veterans nationwide. From Palo Alto to San Antonio to Boston, at every visit, veterans expect and deserve quality care supported by the best technology. To continue delivering a high-quality experience, our clinicians and staff need a modern technology platform that provides improved access to each veteran's health record. As part of VA modernization efforts, we are modernizing our electronic health record, building on the tradition of innovation we began decades ago when we developed one of the world's first electronic health records, Vista. We are embarking on one of the largest government transformation efforts ever undertaken, implementing a commercial, state-of-the-art electronic health record that will deliver full interoperability with the Department of Defense and community care providers, enabling a seamless experience for veterans. Let's hear the story of Angel Lugo's experience in a VA medical center just last spring. Angel served more than 30 years with the United States Army. Tank gunfire and vehicle and aircraft noise from overseas tours led to severe hearing loss. Sadly, he can't always hear when he's in meetings or spending time with his grandchildren. He receives DoD and VA care and recently had an audiology exam at a DoD facility, but VA had no record of that exam, so Angel had to come back for another one.
I had a hearing exam the month prior at one of the military facilities, but when I went to the VA, they did not have that on record. I told them about it, but we had to have another exam. Certainly, it's not always easy to remember everything that's happened to you in your life. Certainly not when you served overseas, you served in austere areas, served in combat. You don't remember everything that happened, all the care that you got. You were focused on the mission. The continuity of care is very significant to the quality of care that veterans receive. Look, I'm a soldier for life. I know I'm going to be needing care for the rest of my life. Whether I get it in a DoD facility or I get it in a VA facility, I want it to be the best care. I want the providers, the clinicians, the physicians to have my entire record without me having to bring it up and recollect what happened in my career.
Electronic health record modernization will help make experiences like Angel's a thing of the past. No veteran should have to carry paper records between VA facilities or explain to a new doctor why they can't receive an MRI or a certain medication. That can lead to inconsistent care and medical errors, and we cannot let that define the care our veterans receive. Electronic health record modernization will finally give VA providers seamless access to a patient's entire health record. And electronic health record modernization will usher in a new age of health data analysis at VA, cutting-edge analytics that will provide caregivers with actionable decision support tools to improve patient outcomes. VA's new electronic health record will push our veteran-centric approach further, giving our providers and frontline staff immediate access to the comprehensive patient information they need when they need it. Veterans paid the price. We have our freedom because of servicemen and women like Angel. They did their job, and we are going to continue to do ours. Let the next chapter of veterans healthcare begin.